You're not just seen as a number here, you're seen as a person. And you're valued as a staff member. I'm Adele Whitehead. I'm a registered social worker and a senior practitioner. I've worked at the Fed for 6.5 years. We do everything that a social worker would do, local authority social worker. So we work with people from newborn up to end of life, all aspects of people with mental health, learning disabilities, people which are poorly, people that just like your regular neighbours who need some extra support in the community. We work with the very religious community and the more traditional community. Yeah, it's been very interesting. It's opened my eyes because the Jewish community become quite guarded. They find they would rather have a Jewish organisation supporting them, and then we're then able to joint work sometimes with the local authority. Some local authority social workers are unsure about maybe the kosher diet and other things, and they like to come for us for guidance around the religious aspects. Worked with maybe children and families who can be quite suspicious of maybe local authority social workers going in, and obviously as part of our role, we're like a bridge. We're able to go out and joint work the case with the local authority and explain, that the local authority are there to support them. Working for the Fed, because we do statutory work and we do non-statutory, it's more person-centred. We're able to make more of a difference. We're able to actually build a relationship with a client and the families, rather than, if we was going in to do statutory work, we would just probably be going in to do one piece of work. We're able to now think outside the box. I go out and make sure that I find out actually what support that they need. Sometimes it can take little baby steps, having to go back a couple of times. So we do the non-statutory work, so we would go out and do an assessment under the Care Act, making all the relevant referrals to maybe a GP, mental health team, referring for equipment, referring for a volunteer. We have volunteers team at the Fed. Also, we have statutory work at the moment, so we have a contract with Bury Local Authority. We have the Discharge to Assess unit, which is within Heathlands. We'd go out and do a statutory assessment, looking if the person needs 24-hour care or if they could go home with a package of care. We would do mental capacity assessments to assess if they have capacity to make decisions about a package of care or if they lack capacity. We also have continuing healthcare contracts with Bury Local Authority. So we're taking somebody through the CHC process. The team's lovely. They all have their own expertise. If you've got any questions about a case, everybody can support you. We are like a little family, and it's just a really lovely team to work for. Every day's variable. You don't know what you're going to arrive into, but it's nice because you feel fully supported by the team. Not only the team, the cast team, it's the teams elsewhere that work in the organisation. I think when I've spoken to friends who work for the local authority, and I've explained about my role, they feel sometimes that they're not supported in the local authority, where we have a very supportive management team, we have case protection on cases. So if there was a newly qualified social worker, they would only have a certain amount of cases, and that's overseen by, for example, myself, who's a senior practitioner. We have a walking system where they can go and speak with the manager if they have any difficulties with cases. There's always support. So I started the Fed as a student. I was in my final placement. I was offered a job here, and I've been able to develop now into a senior practitioner. I worked as a carers advice worker before I became a registered social worker, so I was still a student, and then I became a registered social worker. So I've taken the role now as a senior practitioner and also supporting a newly qualified social worker and a registered apprentice as well. I'm hoping to develop to be a practice educator, to be able to take students on from university. I think at the CAST team we're able to they're able to offer us more statutory training from different local authorities. So if you did actually just work for a local authority, it'd just be solely that local authority you'd be doing the training for. But we're quite lucky being able to tap into 3 different local authorities training. I feel really lucky to have an office that we have. I know from experience from other friends who work in the local authority, they're hot desking. We have our own desk, we have our own telephone, we have a lovely office. I'm a young parent and obviously life can be quite busy, so I'm able to work quite flexible, 3 days a week in the office doing community visits, and then I work at home Thursday, Friday, doing virtual visits, telephone appointments. And that's a good thing. It fits in well with my life balance. So work's been, again, very supportive when, you know, my child's been poorly or there's been other family commitments, and I'm able to work virtually from home.